Okay, so possible consequences for HIV-related stigma for women. Loss of income and livelihood, loss of marriage and childbearing options. We're speaking about like birth. So a lot of the times people think, oh, you can't have a child, or you're never going to be a mother, or you're never going to be the partner that I want you to be. So a lot of the time those are consequences. For care with the health sector, even what Juanita was saying about her doctor asking her to get tested, how you felt, some type of stigma behind it. Can you imagine for a person who comes out and say, hey, I'm actually HIV positive, how the doctor will look at you, or things just like going to the dentist and filling it out a form. So people who are HIV positive are protected under the Disability Act, but that doesn't mean that doctors and whoever's in the health sector will react in the manner that they should. So there's a lot of loss of hope and feelings of worthlessness and loss of reputation. For some cultures or villages where reputation is very important. So can you imagine for those women being HIV positive? How HIV stigma affects HIV response. So fear of stigma and discrimination as the main reason why people are reluctant to get tested, disclose their HIV status, and take antiretrovirals. One study found that participants who reported high levels of stigma were over 4 times more likely to report poor access to care. This contributes to the expansion of the global HIV epidemic and a higher number of AIDS-related deaths. So people don't get tested, they pass the virus on, they never find out. It takes about 8 years for somebody living with HIV to develop AIDS. So you can live for about, on average, right? You can live on average 8 years without knowing any signs, without having any signs that show that you have HIV. So a person doesn't get tested for 8 years, they could be living with that, and then when they go get tested and then they see that they are HIV positive, it may be, I don't want to say too late, but they may be developing into, HIV may be developing into AIDS, which is much harder to care for. An unwillingness to take an HIV test means that more people were diagnosed with AIDS, which is basically talked about. Self-stigma and internalized stigma. Self-stigma or internalized stigma has an equally damaging effect on mental health well-being for people living with HIV. This fear of discrimination breaks down confidence to seek help and medical care. Self-stigma and fear of negative community reaction can hinder efforts to address HIV epidemic by continuing the wall of silence and shame surrounding survivors. So that brings to shame. Shame can be elicited by perceived stigma. It can also lead to internalizing symptoms. Shame is a painful, self-conscious emotion in which one perceives the self to be defective, often in response to perceived failure. So just those feelings of really hopelessness, wrong, that deep pain. One of the characteristics associated with shame is the desire to hide or withdraw from social situations, in part to avoid the situations that may elicit further shame. Shame-prone individuals may utilize more avoidant coping strategies such as watching TV or using the internet to avoid social interactions, which in turn predicts an increase of future depressive symptoms and other mental health problems. So people completely withdraw from social interactions. They're scared that they're going to meet somebody. They're scared of disclosing their HIV status. If they come and meet somebody, like, how am I going to tell my friend that I'm HIV? How are they going to react? What if I meet the love of my life? How am I going to tell that person, hey, I'm HIV positive? Like, so there's a lot that goes in people's minds. Tests here. So when people are about to get tested, they feel deep levels of anxiety, especially while waiting for results, which usually takes about 20 minutes if you get a rapid test. They experience negative thoughts such as my future career goals seem pointless. How am I going to tell my family? They will be devastated. I feel alone right now. How am I going to get this medication? Will I ever be in a relationship? Nothing makes sense now. My life will change, and on and on and on and on. So 1 out of 8 people living with HIV are unaware of the infection. So I would say it's a lot. Everybody should know the status. So I have a question. What if it were you? I want to ask you, what would be some of your reactions or thoughts if you were to get tested right now and you were waiting for your results? Like, how would you feel?
Well, it depends. Like, if I found out that I was positive, I'm about to go to jail because I don't to kill the one person I know I've been sleeping with. To be honest.
Those are like very, very intense feelings and something that perhaps you need to work on. This is just a suggestion. But yeah.
Yeah, for me, like the last time I got tested, it was like a bunch of anxiety that just rose. Like I knew I didn't have it, but like even so, like knowing that you're getting tested and just waiting for those results is kind of like, damn it. Like I know I don't have it, but what's gonna happen? Like I need to see the results myself to like believe it.
I don't know. I never had this problem. You tell me you want to get tested, and I'm like, okay, and I don't even think about it. I'm just like, it's fine, it's okay.
Just feel it.
Yeah, I don't feel anxiety about it.
Well, usually, I think that same with kind of with counseling, people usually go to get tested once they finally have gotten like a wake up call, or like once they got a scare after an experience, and I guess that's why people usually feel so anxious about it. Part of the reason that's why.
Right, definitely. Camilla, you want to say something?
Yeah, I have like a little short story to share, if that's okay.
Yeah, of course.
I got tested I think 2 years ago at Planned Parenthood, just to like check out to make sure I was okay. And they tested like a couple of things. I think it was like chlamydia, gonorrhea, and nothing lethal.
Right, they did like a
yeah.
whole list.
So they were like, all right, like we'll email you the results in 2 weeks. So like, okay. Like about a month later, I remembered that I had got tested. So I went on my phone to check like what the results were. And I guess Planned Parenthood doesn't have like a mobile kind of website. So I was like scrolling like in on my phone to see what it was. And it had all like the diseases and STDs, and they were all there. And then there was 2 columns that were like a check mark for yes and a check mark for no. But I didn't see the no column. I just saw the yes column. So here I am on my phone thinking I have like all of these things. I mean, I didn't because I didn't scroll. But like in the moment, I like what you just showed on the board, how like you feel anxious and you think, what's my family gonna do with me? Like I felt like my whole world's gonna crumble, and like I was never gonna find somebody until I like moved my phone and realized that they were all checked at no. But it's true, like for like 2 minutes I had all like AIDS, and it was like the worst feeling in the world.
Okay. Yeah. Thanks for sharing that. Yeah, it can be very hard.
Yeah.
For me personally, when I got tested, I got very anxious too, and I'm like, oh my god. So what I do to distract myself, I text friends, I play games on my phone, I make jokes with the person who is taking the test with me. I'm like, let me tell you a joke, or you know, like I find a way to like make somebody laugh, make myself laugh, anything to like get rid of like that deep anxiety. So what are some of the things that you guys would do to like, you know, calm yourselves down? Yeah.
I want to say like I'm a pretty open person, that I don't really like, not like I don't want to let like stereotypes or stigma affect me, but I try to just kind of always look at things in a positive light, or spectrums. Okay, well, we told me even medically, and something that actually shocked me was that the CDC saying that those that had high levels of stigma weren't taking their
Antiviral.
yeah, they're
Antiretroviral.
which I thought was, which like not to be clear, I didn't understand, because I was like, well, if the disease progresses, wouldn't that give you, you know, like more stigma and like more problems, and wouldn't it, the best thing to do would be obviously to take medication, not only for obviously yourself, but like for partners or just to take it. But it was like something I like found out like actually so just to like cope if I have prior diagnosis, would I take
for sharing. You want to say anything?
Yes.
Go
No,
ahead.
nothing doesn't. I think for me, what helps is that I just pretty much keep like a strict, like, check of like what I do, and I make sure that it's regular throughout the year to be tested for me at least 4 times a year. Even if I know I just took a test and I haven't done anything in like since the last test, I still want to take it anyway. So I think having that, I know who I slept with, I know what I did, and so forth, really just helps with the anxiety and just keep that in check and stay pretty check.
Just knowing like every step you took.
Yeah.
Okay. Whatever works. So here's some like little tips. It helps to remember that worry and anxiety are emotional issues, and there are things that you can do to help manage it. So the number one thing I would say, do not diagnose yourselves. Do not go on those like empty websites and like, oh my god, I have a lip on my gland
I
or
just did
something.
that.
I literally just did that.
And then
Don't do that.
What then do you use
I have a
for
question. Does it show up on your blood test?
it shows up in your blood test when you're testing for it.
Cause like
So-
now I'm all worried. Cause I've gotten like ear piercings in the last 6 months.
No,
So I'm
that's
like,
good.
I will.
So,
Just
you
depends on
know,
where you go.
don't self-diagnose yourself because a lot of times when you're online, you will see like, you know, you will see like information that it's like not accurate. You will think of yourself like, oh my god, I have a pimple in my face. I have HIV. Like, and you will just like get extremely worried. You won't sleep. It'll just be bad. So don't do that. There's like breathing techniques if you're waiting for those crucial 20 minutes or 2 weeks in the case of Camilla. You can count from like 10 to 1 backwards. You can breathe, deep breathing. You can practice mindful techniques. Just find what works for you. There's lots of resources online for mindful techniques. Find support, talk to a friend, or if you need, call a crisis hotline, which I will give you a few at the end of the presentation. So what are some common responses to HIV diagnosis? For most people, finding out that they are HIV positive raises personal concerns about death and dying, disclosure and stigma, changes in personal relationships, and uncertainties about the future. These stresses can precipitate anxiety, depression, which may contribute to delayed entry into or drop out of HIV treatment. So HIV and anxiety disorders. Anxiety is a common symptom of HIV-infected patients. When anxiety symptoms are severe or persistent, patients may have an anxiety disorder. These disorders include panic disorder, generalized anxiety disorder, obsessive compulsive disorder, post-traumatic stress disorder, PTSD. Amongst HIV-infected patients receiving medical care, 20.3% have been found to have an anxiety disorder, 12.3 meeting the criteria for panic disorder, 10.4 for PTSD, 2.8 having generalized anxiety disorder. So it's good to keep it in mind that many people getting tested for HIV may actually have PTSD from previous trauma, such as being sexually assaulted and things of that sort. Anxiety symptoms such as worry, nervousness, fear, and tension are commonly experienced by people with HIV during the periods of illnesses, which may be in response to stressful situations. So an anxiety disorder occurs when symptoms interfere with patients' daily function, such as unable to leave to work, leave the house, attend medical care, interferes with personal relationships, or cause subjective stress. Moving on to HIV and depression. Clinical depression is the most commonly observed mental health disorder among HIV-infected patients, affecting up to 22% of patients. The prevalence may be even greater among substance use. Depressive symptoms have been associated with risky behavior, non-adherence to medication, and short survival. So sadness and grief are normal responses to many of the consequences of HIV infection. Clinical depression is not. Failure to recognize depression may endanger both the patient and others in the community. Patients with depression are at high risk for comorbid diagnosis of mental illness, alcohol, and substance use, particularly alcohol, cannabis, and cocaine. So Stephanie, as I was telling, or as you were saying, so depression and substance use disorders are associated with non-adherence to the antiretroviral therapy. So a lot of those patients who are dealing with depression end up not taking any medication. Depression remains associated with rapid progress of HIV and increased morbidity and mortality. The treatment of depression improves medical outcomes, and diagnosis and treatment of depression is an essential component for HIV care. So if you ever meet somebody that is dealing or is living with HIV, or if you yourself find yourself in that situation, here are some crisis points that you need to keep it in mind. So for a person that is dealing with that, you want to find out if they are going into like a clinical depression. So learning of HIV positive status, disclosing HIV status to family and friends, introduction of medication, as you were saying, like, you know, it may make you throw up, or faint, or have all the side effects that will make it a crisis type of situation. Occurrence of any physical illnesses. So anytime something occurs with somebody who is dealing with HIV, they think that HIV is progressing, it's becoming AIDS, and anything is going to kill them. Recognition of new symptoms such as decrease in CD4 cells, increase of viral load, necessity of hospitalization, death of a significant other. That's important because anytime somebody dies, that's kind of like a trigger. The person who already has HIV is already like thinking or has thought about that. Diagnosis of AIDS if it gets there. A return to a higher level of functioning, such as re-entry to a job market, school, giving up entitlements. So a person is scared that they may have to disclose that at their job or workers. Major life changes such as childbirth, pregnancy, loss of a job, end of a relationship, relocation, necessity of making end of life and permanency plans decisions. So HIV infected patients do not become depressed simply because of their disease progress. However, it's particularly important to screen for depression during crisis points. Medically ill patients may experience more sadness, grief, and discouragement, or demoralization. However, the presence of hopelessness, the absence of pleasure from usually pleasurable activities, ruminative guilt, and suicidal ideation may indicate accompanying clinical depression requiring psychiatric intervention. So I want to show you guys another video. So this is more like a fun video. They're British, it's a cute accent. So it's about HIV and stigma and things to not say to somebody who's HIV positive.
So, how did you get it?
You've got a child.
You're so brave.
If you give me a blowjob and I wear 2 condoms, will that be okay?
How long do you have left?
Oh God. People have cried on me. You're going to die.
Oh, and you're on medication. Oh my God. Oh, I'm so sorry. Somebody who's HIV positive now can live equally as long as somebody who doesn't have HIV.
She was looking up at me with sort of panda eyes from crying after discovering. She said, "You know, Andrew, I'm gonna be there till the end." And I was like, "Well, darling, that's about 70 odd years away." I was like, "I'll be bored of you by then."
Oh, so this is a question I get asked a bit. So you can't ever have sex again?
No, being HIV positive does not mean castration.
People get messages all the time. So if you've got HIV, can you have sex? It's like, yeah, that's why I'm on this app.
There has been a partner study. HIV positive people on medication are not passing the virus on. It's people who do not know their status that are passing this virus on, and they're the ones that stand in the corner and point their fingers at the likes of you and I and say, "Be careful of him, he's got AIDS." You should tell people straight away.